Welcome back to AFGE's Inside Government, available on demand at InsideGovernmentRadio.com. Joined now by our good friend Bob Weiner. Bob is a former senior staffer in the Clinton White House, among a number of other hats that he's worn throughout government. Bob, welcome back to the program.
Thanks, Jason. And it's just a pleasure always to be with you. And we had talked off air. I really hope that one of the messages that comes out of not only this conference, but all that we're doing is the joy of working in the government in contrast to the negativity that's out there from people being cynical and trying to damn government workers. I've had the privilege of working, as you know, for Claude Pepper as his chief of staff. We abolished mandatory retirement. Charlie Rangel, John Conyers, who I worked for before I went to the Clinton White House, Ted Kennedy, and then in the White House for Bill Clinton and General McCaffrey. These are some great people, and I would urge everyone out there, especially, I was the first youth vote director for the Democratic Party at the Watergate, and I've sort of gone from Watergate to Whitewater. I'd urge everybody to make a point of it. These things don't happen just because, somebody else does it and you can't be part of it. It happens because you apply for a job, you push, you make the phone calls, you send your resume, you follow up, you make more phone calls. It took 6 months until I got my first job at the Watergate with the DNC. So I'd urge everybody to do that. Urge your kids to do that and to enjoy the thrill of being part of the government and of having some impact in policy, where I've had some impact on from Social Security to the youth vote, and to drug policy and crime and government defense contracting and so forth. You can have some enormous impact if you make a point of applying and being part of public service, and it's a really thrilling career to get into.
Bob, how important is it to get that message out there through people like you? I mean, I'm looking down at your roster, and you've got Pepper, Rangel, Conyers, Clinton, General McCaffrey, all of these positions that you've held, all of these important roles that you have held in government. How important is it to let people know the value that government is?
Well, it's really important, especially in view of the cynicism that's in the Congress today and the obstructionism that's there. That's not the reason for public service. The reason for public service is to get something done and to compromise, which, by the way, used to happen before Gingrich. And then he came in and rocked the boat, and ever since it's been partisan. Medicare and Social Security, Jason, happened. There were arguments, some of the same kinds, but they had 60 to 80 votes. The Civil Rights Act, 60 to 80 minority votes. And then Obama comes in with the health bill and gives 160 amendments to the Republicans for tax breaks. In any other era, that would have gotten 60 to 80 minority votes as a proper compromise. But these guys are so obstructionist in trying to make the message against the president who's trying to get something positive done that they'll do anything, give up their souls in order to try to get their politics accomplished. That's not why I went into public service. And that's not why I would urge all of our listeners to go into public service. Let's correct this mess by getting you all out there as listeners into public service and doing the right thing, which is to get something done for the country.
Bob, you bring up a great point about health care. Let's talk a little bit about that. Here we are today at the 2012 Health Action Now conference by Families USA. Tell me a little bit about where we are today compared to a year ago when we talked.
Well, you remember, Jason, that it was Radio Row that we made the point that we didn't want a 60-vote rule in the Senate. We wanted to go to the 50-vote, which we called sequestration, because we had the technical opportunity of a budget bill that it was a big part of. So we were able to do that. You remember that, and I'll damn my own party as well as any other. It was Reid and Rahm and the White House that were saying we had to go to 60. So in this Radio Row, we ran around and we said, call Reid and the phone number, and call Rahm and the phone number at the White House, who was then chief of staff, and tell them we want a 50-vote margin so we can pass this health care bill because the Republicans are doing nothing but obstructing it. And thousands of calls came in from the 20 stations that are here in this kind of a Radio Row, and it took 1 week. It was kind of like the computer thing that just happened, the internet thing that just happened. It took 1 week for them to reverse and say, we'll go to sequestration, we'll go to a 50-vote rule instead of a 60, and the health bill passed and became law. But the Republicans are still trying to kill it. They still want to stop it. And to me, it's astounding that the debate moderators have just allowed the candidates to say they'll repeal Obamacare and never asked them what they do about the 2.5 million kids that are receiving care on their parents' plans, that half of Americans have pre-existing conditions that are now covered by the bill, that 50 million seniors are having more of their life-saving drugs covered under the donut hole that's going to disappear now, that preventive medicine's covered, that people are for the first time covered for life, and that without the bill there would be 30 million people without health insurance, which all the studies, and most recently Harvard, say would die sooner. So what, the Republicans want to just give all that away? We're not going to let them, but the Supreme Court might allow it. But we're not going to let them do it in the Congress. We've got to keep the Congress, the House, turn it over. We got to keep the Senate, and we got to get Obama reelected to make sure this happens.
AFGE's Inside Government here with Bob Weiner, the former Clinton White House senior staffer. Bob, are you comfortable with where the health care bill is today in its implementation?
Well, they're doing the best that they can, given that there had to be a compromise, and Obama did compromise to get this bill through. It's through the private insurance companies, except for the Medicaid provisions, but the rest of it is not single-payer. Jim Clyburn's one of the few who realized when he said on MSNBC that there is a single-payer in the bill, and it's the Medicaid expansion, and that's 30 to 50 million people. But aside from that, it's through the private profit insurance companies, and that's why we have we're in the 40s in life expectancy and infant mortality in this country. We don't have the best, and we're spending twice as much because we're paying the insurance companies for nothing. But the bill does force now that benefits have to be 85% of what you get, and only 15% can go for overhead. The insurance companies hate that. They hate that there can be regulation of the premium amount. So the bill does an enormous amount. It provides coverage, but it isn't the best system we can get. Ultimately, we will have to go to what every other country does, and that's a single-payer system. Why should you not have health care as a right in this country? That's a clear message. Obama would have done it if he thought he could have gotten the votes. There are some of us who thought that actually the votes were there with 52 or 53 in the Senate and a majority in the House to go to single payer. But the calculation by the White House was that it had to go to the private insurance plan. And if you remember, by the way, that was the debate between President Obama and Hillary. Hillary would have gone to a single payer, and Obama wanted to do the private insurance mechanism as a compromise. That was the difference in them, the difference. And so we are where we are. It's an enormous plus. It is, all those provisions of kids on their plans and no lifetime caps and no pre-existing conditions, that's an enormous plus. And the Republicans want to take all that away and bureaucratize it. And Romney finally, this is the first time he said it last night in the debate, finally said that they would at least do a separate bill if they were to repeal it. But we ain't going to let him go that far.
Bob, as we look forward to 2014, what is the single most important thing to do to ensure full implementation? You know, I'm a big one on public, that's why I got into public service, on public intervention and public involvement. And when you have a Supreme Court with Alito, Roberts, Thomas, Kennedy, and Scalia, all programmed to vote 5-4 against anything like Citizens United, they come in with putting corporations in charge of politics, and Bush v. Gore. When you have a court that does that, and it's based because they think those are the signal issues that are their appointers' desires, and they're appointed. You know, we don't have a court with people in robes who are patriotic, who believe so much for the country. We have people who respond to their interests as well. And when you have that, and when you have Clarence Thomas, whose wife takes money, and the Thomases are in direct conflict of interest and should recuse himself, but you have those kinds of 5 people that are going to go 5-4, I'm very worried about what the Supreme Court can do. But just like we did in the computer, in the internet thing, the public can intervene and scare the hell out of policymakers, and the Supreme Court are policymakers. So I'm hopeful that people will call the Supreme Court, call the offices of Alito, Roberts, Thomas, Kennedy, and Scalia, and give them thousands of calls and thousands of letters and thousands of petitions, and make them realize that they, in their richness and their robes and their elitism, shouldn't be the ones saying that the rest of the country shouldn't have health care when they rule. Bob, 2 questions for you. One, do you think Romney is the Republican nominee? I think that the tracking is showing that it's now a dead heat, or Gingrich is slightly ahead in the polls in South Carolina, but he's run such an inept campaign that he couldn't even get on the ballot in Virginia, and he's got problems in half the states, that it probably will be Romney. They're going to be limping in with Romney, but then you got a guy who, as you know, lets Detroit go bankrupt, he says, let housing hit bottom,
thinks corporations are people, thinks $375,000 isn't much money, or you can choose the party of the child janitor and the wife swapper, which is Gingrich. I mean, you can pick one. They both have really flawed nominees. So I think it's going to be Romney, but if it's Gingrich, we're going to be happy running against either one.
Second question, what's the key issue for the presidency?
I think it's the economy, and I think it's the fact that the debate moderators, whether it's foreign policy, whether they never ask if the Republicans have any real alternative that would have succeeded as Obama did in taking down bin Laden, al-Awlaki, and Gaddafi and reversed the Bush bleeding of 750,000 jobs a month, rescued the auto industry and the nation's financial institutions, and put the country back to 22 straight months of increased jobs. I think that's the key, is the economy, and the Republicans want nothing, a 95-year-old friend told me, but tax breaks for their rich buddies. And so it's that versus what Obama has done and will continue to do to try to help the economy.
Our good friend Bob Weiner, former Clinton White House senior staffer. Come back and see us again soon, Bob.
Thanks, Jason.